At the end of 2019, we were shocked by a virus that spread to almost all parts of the world. The virus is the coronavirus. So, what is coronavirus? Coronavirus are a large family of viruses. They are found in animals as well as humans. Some of them are known to infect people and cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome or MERS and severe acute respiratory syndrome or SARS. Novel coronavirus is a new strain of coronavirus which was first detected in Wuhan, China in December 2019. In the following months, it spread to other countries with cases doubling within days. This virus is the severe acute respiratory syndrome related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What are the symptoms of COVID-19? In general, COVID-19 causes mild symptoms such as runny nose, sore throat, cough, and fever. For some people, the symptoms can be more severe and can cause pneumonia or difficulty breathing. This disease has also proven to be fatal. From these symptoms, there are several categories of people who are infected with COVID-19. That is, 1. People under surveillance is a person who has one of the symptoms of COVID-19. These symptoms are respiratory disorders such as coughing, runny nose, sore throat, and shortness of breath. Usually, people under surveillance must undergo isolation at home and the condition will be monitored for 2 weeks. People under surveillance is immediately taken to the hospital if the condition worsens or if laboratory tests show positive result. 2. Patients under surveillance are people who have symptoms of fever or respiratory problems. These people usually have a history of travel to COVID-19 infected areas or contact with patients. Close supervision is applied to patients under surveillance so as not to experience worsening. Patients are hospitalized in isolated rooms, laboratory examination, and close monitoring of anyone who comes in contact with patients under surveillance. 3. People without symptoms is a term to indicate people infected with the coronavirus but doesn't show certain symptoms. In some cases, people without symptoms can undergo independent treatment with a doctor's supervision. This patient must carry out self-isolation for 14 days and apply a clean and healthy lifestyle. People without symptoms should stay separate to prevent the spread of infection in other family members. Then, how can COVID-19 spread? COVID-19 is known to most easily spread through close contact with people infected with COVID-19. If the close, far from infected person like coughing or sneezing can enter through your breath. This virus can also be transmitted if an infected person comes in contact with an uninfected person. Even dead splashes can also fall on objects and surrounding surfaces. If the object or surface is touched, then an unaffected person touches their eyes, nose, or mouth, the virus can enter the body. So, what should we do to prevent the spread of COVID-19? First, maintain health by exercising regularly and consumption of nutritious foods, especially those containing vitamin C. Second, wash your hands regularly with soap and water or use hand sanitizer. Third, when coughing or sneezing, cover your nose and mouth using a tissue or with folded elbow. Fourth, avoid touching the eyes, nose, and mouth because viruses or other germs can stick to the hands. Last, use the mask properly when sick or in a crowd.